Thank you, and before I get started, I'd just like to acknowledge the traditional owners of the land on which we're meeting today, who've lived on and looked after the country for many thousands of years. I pay my respects to elders, past, present and emerging, and elders of any other communities who may be here with us today. So what I'd like to talk to you about today is really probably focusing in on that ninth area within the Green Paper around sort of education and collaboration, really focused on prevention of mental injury in the first place. Obviously, across all workers' compensation jurisdictions within Australia, we're seeing an increase in mental injury claims. We know that these claims often have worse outcomes than physical injury claims, largely due to the poorer return to work outcomes, and that's enough to create significant financial pressure on our schemes, not to mention the significant human cost that comes with these kinds of injuries within the workplace for the individuals concerned and society more generally. Focusing, however, on claims is really a bit tricky. We know it's a lag indicator, and it's actually not a very good measure of how mentally healthy and safe workplaces are. And so whether that increase we're observing is due to more people experiencing difficulties, or because more people are becoming aware that mental and physical health and safety is protected under OHS laws and therefore compensable when a mental injury develops, is debatable. And untangling that relative contribution is probably less important in the prevention side of things than it is to focus on what works to prevent injuries from happening in the first place. Because this helps both those who know that they can make a claim for workers' compensation for a work-related mental injury and who feel comfortable enough to do so, as well as those who don't. And this is really because prevention helps us to create workplaces that are less likely to create harm in the first place. The difficulty we've got with prevention of mental injury, though, is knowing what works to prevent mental injury and also to promote good mental health at work. There's not really a strong evidence base about what's effective, and controls tend to be very context specific to the nature of the work, to the particular vulnerabilities of workers, and to the approach needed to make a shift within the prevailing culture, within the workplace and the industry, etc. So, amongst a number of things that WorkSafe Victoria has been doing to try and improve mental health and safety in Victorian workplaces, I want to briefly mention today our WorkSafe Work Well program. This is a 5-year, $50 million program of work delivered by WorkSafe Victoria in partnership with the Victorian Department of Health and Human Services. Like all of our efforts focused on mental injury prevention, the program is really aiming to undertake initiatives and use levers to drive improvements in the factors at work that can create hazards in this area. We're doing this through two main activities. So the first thing that we want to do is use the current evidence that is out there and what we already know to provide useful, actionable, evidence-based information to workplaces, tailored based on their level of OHS maturity that encourages them to take action. This is our Work Well Toolkit. It's a website targeted at employers, that is business owners, managers, OHS areas, HR, etc. Users register and then interact with the site over time, completing actions on a dashboard and in doing so, making their workplace more mentally healthy. And here we're aiming for a population level effect. We want as many workplaces across Victoria to become a little bit better. The second part of our program is to contribute to building the evidence base. So here we're giving out large-scale grants at an industry or sector level to trial interventions and evaluate them to learn what works and what doesn't. We then intend to scale up the things that do work, for example, by adding that content onto our Work Well Toolkit, into our guidance, etc., and stop doing what doesn't work. And these are our learning networks and our mental health improvement fund, and we're in the process of giving out about $25 million of that $50 million to those programs of work. We were encouraged today to talk about what's working, and it's relatively early days for us so far in measuring the impact of this program. We are halfway through, but we do expect that our outcomes won't be seen for quite some time. But we are seeing some early indications that things are moving in the right direction. And what is most pleasing to see is that we're starting to shift the conversation. We're moving from a situation where workplace mental health conversations have been dominated by talking about what it is that people bring to work with them. It's about the individual. It's about us needing to know what to do if someone isn't going very well, things like mental health first aid, resilience training, employee assistance programs, etc., which are all really important. However, they're not true prevention in the primary prevention sense of the word. So what's been underpinning our focus is a recognition, and where we're starting to see the conversation shifting, is that there are things about the nature of the work people are asked to do that are bad for their mental health. These can cause stress, which can lead to a work-related mental injury. Working out how to arrange work so that these stresses are eliminated or minimised is where employers need to direct their efforts. This is within their control and it can prevent injury. It's taking a systems rather than an individual approach, the environment rather than the worker being the point of intervention. And as an added bonus, this creates positive work environments, which is actually protective to people's mental health more generally. This can benefit broader society because good work is one of the social determinants of good mental health. People have meaning and purpose and build important social connections. Never more important than now with the challenges we're facing as a society with our mental health. I mentioned the importance of focusing on primary prevention, and this is really about creating good work instead of the secondary area to intervene, that is, where signs of stress are already evident. That can only ever reduce the time spent in distress or with an injury, but it can never impact on the number of people who are affected in the first place, and that's what we're really about in the prevention game. And the evidence is that addressing these things that remove or reduce stresses in the workplace can not only prevent mental injury from occurring, but they also help with recovery and return to work if an injury does unfortunately occur. So there is again that further benefit from these prevention activities. So that's really the conversation we're starting to have with workplaces in Victoria, and we're starting to see that recognition of people understanding where they can take action that will make a difference in this area. We're really looking forward to continue to monitor the impact of our interventions over time and start to see that we're beginning to shift attitudes and behaviours and ultimately lead to mentally healthier workplaces. Thanks.